Okay, Dr. Morgana.
Shall we start?
You're good to go.
Thank you. Very good afternoon, ladies and gentlemen. Salam sejahtera. Before we begin today, kind request from us that you mute your microphone to avoid background noise. Very good afternoon again. Now, in late 2019, a previous unidentified coronavirus, currently named as the SARS-CoV-2, emerged from Wuhan, China, and it expanded globally, including Malaysia. The disease was officially named as Coronavirus Disease 2019, COVID-19, by WHO on February 11, 2020. Now, it is normal for the virus to change and evolve as they spread between people over time. When these changes become significantly different from the original virus, they are known as variants. To identify this variant, scientists have mapped the genetic material of viruses and then look for differences between them to see if they have changed. Now, since SARS-CoV-2 virus, the virus that basically causes COVID-19, multiple variants have emerged and have been identified in many countries around the world. For the purpose of differentiating these variants, WHO began using Greek alphabet in 2021. Now, all these variants are different. The Omicron variant has a large number of mutations that may mean that the virus acts differently from other variants that are circulating. Is this true? Now, the Omicron variant was first reported on 24th of November, 2021, and it was classified as variant of concern 2 days later. It would be good to have everyone mute your microphone. Thank you. Right. So as of December 1st, 2021, there are limited information about Omicron, how the variant responds to existing treatment, or whether the infection or reinfection with Omicron may cause less or more or less severe disease. So what do we know of Omicron? If it is less severe variant, why are people still ending up in the hospitals? And why is it still killing people? And if it is highly transmissible, can we really protect ourselves? Ladies and gentlemen, welcome to the webinar jointly organized with the Malaysian Pharmacy Society Education Chapter and the Medicine Health Cluster of the Academy of Professors, Malaysia. I'm Dr. Morgana, and we are very fortunate today to have three esteemed panel members here today. Firstly, let me introduce Professor Dr. Zamberi Sekawi. He's a professor of medical microbiology and senior consultant, clinical microbiologist, and the dean of the Faculty of Medicine and Health Sciences, University Putra, Malaysia. He's also the chair of the COVID-19 and Infectious Disease Task Force under the Academy of Professors, Malaysia. He's actively involved in infectious disease research and current issues. Prof. Zamberi has published in more than 170 citation index journals and has authored several books. He's currently the chair of the Malaysian Influenza Working Group, which focuses on the control and prevention of influenza. He's also a strong advocate for the use of vaccines for infectious disease prevention. Welcome, Prof. Zamberi.
Thank you, Dr. Morgana. Thank you for having me here.
Thank you, Prof. Next, let me introduce Prof. Sheikh Azhar Sheikh Sulaiman. He's a clinical pharmacist and the former director of Advanced Medical and Dental Institute, University Science Malaysia, also a former dean of the School of Pharmaceutical Sciences, University Science Malaysia. Among many accolades and awards, he's an expert in infectious disease, including COVID-19, TB, HIV, where he has worked closely with various world-level organizations, including WHO. Prof. Azhar has published almost 600 papers and have received various awards around the world. He's also been the international figure for clinical pharmacy and has been linked with more than 36 universities worldwide. Thank you for being with us today, Prof. Azhar.
Thank you. Welcome, everyone.
Thank you. Let me now introduce our third panel member, Dr. Rahila Ambaras Khan. She's a clinical pharmacist and the head of pharmacotherapy services, Hospital Kuala Lumpur. Recently, she's been awarded subject matter expert recognition in infectious disease from the Ministry of Health, Malaysia. At the pharmacy department of HKL, she's coordinating many committees, including the Antimicrobial Stewardship Committee. At the pharmaceutical service program level, she's involved in the critical care of pharmacy field, expansion of antimicrobial stewardship, amongst others, providing also input towards common drugs used for COVID-19. Ladies and gentlemen, thank you very much again for being us today. So let's begin the section of question to Dr. Rahila. Dr. Rahila, welcome again. Now we know that for those without any underlying health issues, treating Omicron is primarily supportive, similar to all the previous COVID-19 variant. In the hospital practice, what do you think are the current treatment options that are being used? Is there any difference with the treatment used between these variants?
Okay, thank you, Dr. Morgana. Hi, everyone. Can you hear me now?
Yes, doctor.
Somebody muted me, sorry. Okay. So pertaining to the question, what is the current treatment option for Omicron? I maybe can further categorize this to patients that does not require hospitalization, and second one is patient who require hospitalization. So for patient who does not require hospitalization, basically it will be a symptomatic treatment. Okay, for example, if the patient having fever, so obviously the patient needs to take paracetamol, and if the patient having cough, for example, so the patient can take cough mixture. Among this group of patients, if let's say they are at higher risk to progress to severe COVID-19, actually there's some evidence on antiviral use for this kind of group. Okay, who are they actually? They are immunocompromised patients, which we does not expect. This patient mount like adequate immune response to COVID-19 immunization because of their condition. So they are the candidate for antiviral. Other than that, basically patient with comorbidities, including elderly and obese patient. Okay, so what type of antiviral recommended for this kind of patient? Basically, growing evidence on the Paxlovid, the Limatrevil and Ritonavir. Some of the evidence on Molnupiravir as well. Basically these two, plus we can also give remdesivir is it's not really recommended by WHO. So basically these two antiviral, Paxlovid, as well as Molnupiravir, and also one of the monoclonal antibody, for example, the Sotrovimab. This is also recommended for the patient who does not require hospitalization. Okay, let's move to patient who require hospitalization. What are the treatment options for this patient? So basically, they are at category 3 to 5 as compared to patient who does not require hospitalization, which usually at category 1 and 2. So category 1, basically no symptom, category 2, symptom without pneumonia. Okay. So for the hospitalization patient, the treatment basically thromboprophylaxis, for example, unfractionated heparin, okay, and also low molecular weight heparin, for example, enoxaparin. Why we need to give thromboprophylaxis in a COVID patient? We have to understand that COVID disease basically is a prothrombotic, which patient can have hypercoagulability. They can easily get thrombosis. That's why in the hospital, we are giving them thromboprophylaxis. Apart from that, a patient may require oxygen therapy. It will start with the lower oxygen, for example, nasal prong, and patient may require higher oxygenation until the high flow nasal cannula, for example, and end up with the mechanical ventilation. So for patients who require oxygenation, there's strong evidence in giving them corticosteroid, okay? For example, dexamethasone, as well as methylprednisolone, okay? So we will give patient on corticosteroid when the patient actually need the oxygen therapy. Apart from that, in the hospital, we're also giving the patient remdesivir, okay, for Omicron. Basically, the kind of patient that we will choose is patient with, let's say, less CT value, okay? And bear in mind that to give antiviral to hospitalized patient, we have to make sure that it is within 10 days of illness, okay? Then it will be effective, not like later, okay? Apart from antiviral, we can also give the patient on immunomodulator, for example, tocilizumab, okay? It is interleukin-6 blocking receptor. Okay, so why we give tocilizumab? Basically, it has been found that patients with severe COVID, they have elevated interleukin-6. Okay, that's why we give tocilizumab. It is interleukin-6 inhibitor. In the hospital, government hospital, we're also giving patient baricitinib. Baricitinib is a Janus kinase inhibitor. Basically, it will reduce the inflammatory cascade and really help in the hospital. So we are using that as well. This is roughly a treatment that we are giving to hospitalized patients with Omicron. Coming back to your question just now, what's the difference between now and the previous variant? Okay, so I go back to the category just now. If the patient non-hospitalized, okay, they are basically category 1 to 2. As I mentioned earlier, for Omicron, we have monoclonal antibody that actually recommended, which is sotrovimab. But for the earlier variant, REGEN-COV or casirivimab, imdivimab is actually effective, but it is not effective towards Omicron. Why? Because we understand that, as mentioned by Dr. Morgana just now, a lot of mutation in spike protein of this Omicron, and that's why certain monoclonal antibody actually is not effective. So it has been proven in vitro that sotrovimab is still effective towards Omicron, but not REGEN-COV. So REGEN-COV was using earlier, but not recommended for Omicron. Okay, that's about patient who does not require hospitalization. So how about patient who require hospitalization? So basically, the treatment are the same. It's just that, as mentioned by Dr. Morgana, actually Omicron is less severe. Okay, so some of the I can say that if we compare to the earlier variant, if we go to the ward, okay, we can say that 80% of the patient actually will be put on oxygen. But now with the Omicron, actually only 20% will be on oxygen. Okay, why? Because now it's more on the patient actually admit, not because of the COVID related to Omicron. Patient actually, we call it as incidental COVID. Incidental COVID, whereby, for example, patient met an accident, okay, and then they admit to the hospital, tested to be positive. That's why for Omicron, you can even see patient with category 1 end up in ICU. Not primarily because of COVID, but because of trauma, for example. Okay, so that's why now oxygen therapy is really less, for patient with Omicron as compared to Delta, whereby we can see 80% will be on steroid, and then 80% will be oxygen. When they are on oxygen, they require steroid. So the patient will be put on higher dose of dexamethasone, for example, 20 milligram OD, and beta-prednisolone 2 milligram per kg per day. If I compare this to Omicron, okay, Omicron, maybe some patient only require 8 milligram in ICU as compared to 20 milligram before. Okay, and then in terms of immunomodulator, if we compare with the earlier variant, okay, they really require, because they actually having the cytokine storm or cytokine release syndrome. Okay, so we need to use tocilizumab and also baricitinib. Unlike Omicron, not everybody actually will be put on this baricitinib and also tocilizumab. And if I can share, in the earlier variant, for example, Delta, we can see patient actually progress to organizing pneumonia, whereby they need to be put on 6-week therapy of prednisolone, for example, heparin dose, and they also end up to have pulmonary embolism because of the cytokine storm. But we don't see this much with Omicron. That's basically the difference. The difference because of less severe, so they might not require the same treatment, aggressive treatment as for Delta. That's something that I can share.
Right. Thank you, Dr. Rahila. Now, we are also seeing reports that suggest that because Omicron is so transmissible, eventually everyone might get it. Now, many people are wondering if one gets infected with other variants, what is the possibility of reinfection with Omicron variant? What do you think?
Okay, basically, as what you mentioned, this Omicron is highly contagious. Okay, patient who, for example, having the COVID infection before, or patient with vaccination, they can also vulnerable to this Omicron. Okay, because it is highly contagious, and there's a growing evidence actually showed that this patient, even though it is highly contagious, but less likely for the patient to be hospitalized. Okay, because it is less severe. One things that I think why it is less severe that I can see, most of the literature mentioned it is like less lung infectivity. Okay, because it affect more to upper airway. Okay, when it affect more to upper airway, our nose, mouth, that's why it's like easily, transmit to others. But it does not really affect our lung. That's why even in ICU patient, you can see less Omicron patient, I mean the COVID patient with Omicron end up with COVID pneumonia. Okay, that's different. Even though it's like a high, transmissible, but it is like less severe as compared to previous variant.
Okay. Now, despite COVID-19 jeopardizing the world for more than 2 years now, as we've seen it, many are still confused on the tests that are available. So mainly PCR, RTK tests. Now, what are the differences between these two, and how should the public choose?
Okay, so I maybe can share something that I learned from my microbiologist. Okay, So for PCR, what we understand that it is a gold standard, for the COVID diagnosis. Okay, it is highly sensitive and highly specific. Okay, as compared to the self-testing or RTK. Okay, RTK can the sensitivity is about more than 95%, of course, but PCR is about 99%. So it can actually detect even if the viral copy about 10 as compared to RTK test, basically around 300 to 400 copies, then you can detect. That's why when you test with PCR, it's positive, but when you tested earlier with RTK, it's negative. But bear in mind, this PCR test, sometimes some patient maybe they tested positive PCR and then after 7 days they test again to see whether negative or not. So you have to know something that this PCR actually very sensitive. It can also detect the died virus. So because of that, when you test it, you still positive. But when you go to this RTK, which is detect the protein, it is not positive. So you don't repeat the PCR test basically. So how are you going to choose? If you ask me, I would suggest for myself, if let's say, okay, we have to do with the RTK because I think it is like, you can get rapid result and then it's cheap as well, you can test it. But if let's say you have like exposed to somebody with COVID-19 and then you also have symptoms, okay, if you test multiple times with the RTK, it came to be negative because, of course, the sensitivity is not 99% as per PCR. Maybe you can proceed with PCR test to confirm. One thing that maybe, everybody need to take into account when you use the self-test kit, you really have to follow the instruction, okay? I have watched one video from, this under Astro Awani, one of the speaker from MKFK actually suggested that you have to follow the instruction, okay? In terms of you taking the swab or taking the saliva, okay, that they actually refrain us like, for example, you smoke and then you take, so it actually not very much like sensitive in that sense. And then you have to follow instruction. How do you read the result? Is it after 10 minutes? Is it after 20 minutes? Okay, and the drops that you have to put, you have to make sure, is it like 10 drops? Is it 5 drops? Is it 20 drops? So it depends. So different kit is different. So you have to follow the instruction to actually get the good result.
Right. Thank you. Thank you, Dr. Rahila. Now, lately, we see there are many cases that shows a negative self-test result. But when they test with PCR, the results were positive. So why do you think, what do you think is the reason for this?
For me, it's simple because PCR is, highly sensitive and specific as well as compared to RTK test. And then another thing you have to see, when is actually your symptom. Because if let's say you have symptom, you maybe can get positive result, okay, 1 to 5 days of fever, for example. But if you don't have symptom, you actually can check 3 to 7 days of illness, then it can be positive. So the timing is also important, timing of that RTK, and then the type of kits, like how sensitive is the kit. Okay, that's all from me.
Okay, thank you, Dr. Rahila. Now, self-test kit is the most affordable and most accessible for public. We all know it, and we basically can find it anywhere nowadays, from clinics to pharmacies to convenience stores, malls, everywhere. Prof. Ashar, where do you think the public should buy these self-test kits?
All right, thank you, Dr. Morgana. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Very good afternoon to everyone. Okay, when we had this Omicron before, everybody was just like, oh my God, we just had Delta, and then here comes Omicron. So everybody was just like a little bit panic about it. But as mentioned by Dr. Rahila just now, the severity or the rampantness of the disease itself, it doesn't really involve so much of the severity, because it's only mostly covering upper part of our anatomy. So that, like the nose, the throat, and so on, not so much to the lung. So we are suggested by KKM to do the self-test, and people are wondering whether the test kit, as mentioned, is it reliable or unreliable? Where to buy it? Can I just simply purchase from anywhere, which is convenient at this point, but we cannot compromise convenience with the safety. That is one thing that we have to be alert about. So before we start that, before I answer that question, we have to realize that the RTK-AG can only detect the infectious condition on the 3rd day until the 7th day after somebody is being exposed to the COVID. While, of course, as mentioned by Dr. Rahila again, RT-PCR can detect as early as 2nd day until the 14 days after being infected. So all these things might have the impact on the condition of the patient, and also how the patient is taking a sample. For example, a lot of literatures in some of the other countries have shown that if somebody have eaten something or taken something or drink something that changed the pH of the saliva, it may have an impact on the result. Or somebody just simply gargle first, and then, with the salt water or whatever gargle preparation that is available in the pharmacy and also online, of course, you won't get it. And how much of that sample being taken is another issue that we have. Yes, RTK-AG will help you to really detect it an easy way, because some people are not comfortable with the RT-PCR, where they have to probe into the nose, into their mouth, and which is a little bit not comfortable for them. So this rapid test kit antigen is very fast. You can get the result in a few minutes, and it's cheap also. And while the PCR things is going to be slightly more expensive, but more sensitivity. In both tests, it is supposed to be sensitivity above 95, and also the specificity is also above 95%. And with PCR, it's almost 100%, it's 99%. But again, there's that 5% that we have, you might have false positive or false negative. And for those people who might have all these things, could be because of the contamination of the virus around the area, or that the test cannot detect the antigen for that particular patient, because it's just probably 15 copies instead of 300 copies that can be detected. And also this wrong sampling technique, and also the time, you have taken, like, you already have been exposed after 2 weeks, and then you're trying to test now, and definitely it's going to be not showing anything. for that matters. So back to the question, where should I buy this? And currently you can see it's everywhere: supermarket, convenience store, even the petrol station. You remember when we have the outbreak of this COVID, where the masks are not available in the country? Still remember that point? Yeah, and everybody is looking high and low for the mask, and turn out to be some of these are not a good mask, which is a fake mask that supposed to be medically and so on. But again, this is where what happening with the test kit currently. I understand that the low price and easy access would benefit the consumer, but again, as I've mentioned, we cannot take this matter lightly without considering the negative repercussions that probably happening during this kind of thing. We have bringing death, increasing in numbers. What is happening here? And we should be dealing with the self-test kit from pharmacies, from the specific private hospital or private location where the KKM has already identified them, and all these things should be certified by the Medical Device Authority, MDA. And currently, if you look at as 10th of March, recently, a week ago, there's about 125 test kit available, which is certified by the MDA. So it's supposed to be looking at all these things, and the people should be realizing that we are not talking about the cheaper the better, and we are not also talking about the more expensive is much better. But the thing is, as long as it is being purchased at the right place with the right things, with MDA approval and so on, you should, or all of us should understand that this self-test kit is not a toy. It's a medical device that should really comply with the certain gold standard in terms of functionality and also safety. So the best thing is that try to get it at the pharmacy, where the registered pharmacies can really not just selling this kit, but they are able to educate the public on how to use it properly. As mentioned by Dr. Rahila, there are people or the public are just simply, put 1 drops of saliva, or they just swap in a different way, So this might again have the impact on the result of the test, and they thought, oh, fine, I'm okay, I'm negative. But for all we know, this particular person could bring all the other condition getting worse for the whole family even, So the pharmacists and also the people who are selling all the test kit for that being approved by MDA will educate the public on how to use it properly, and help them to report through the My Sejahtera application. So we know that we might have problem with all these things because of the matter of scam. They are putting people at risk of false sense of security. We even have the video showing that testing with the tap water is going to be positive. So that's a lot of things that we need to really look into that. So I highly recommend that purchase the appropriate test kit at pharmacy or specified places, medical places where they are supposed to sell all these things, where we might not involved with the scammers that are dealing with the false test kit. And if you read some of the articles, news around the world, say, for example, in UK or India, this self-test kit is only available at pharmacies and certified bodies. They are not being sold, elsewhere at whatever point it is. Yes, we would like to make easy for the community to get it. But again, as we can notice now in Malaysia, there are pharmacies everywhere. There are, there are private hospital or private clinics that are selling, established to sell this kind of test kit. So again, before we really involve in all this false test kit thing, and we thought that we are okay, but actually we are not. So get your test kit at a specified places, especially from the pharmacy, where the pharmacists themselves can help you to tell how to use it properly. Because without a proper knowledge, all of us will have a false result, and at the end of the day, probably the situation is going to be worsened than what it's supposed to be right now.
Yes, thank you, Pro. I think you have a very important point here that although these self-test kits are available in many places, but certain authorized places like pharmacies, clinics, hospitals are at the end most reliable, because you do, there are doctors, pharmacists, and all those authorized medical practitioners who can advise how to use this test kits properly, and that is very important. Now, the MDA list, as Prof mentioned, I think is already made public, so everyone can basically check if whatever test kit they're buying, brands are actually genuine. And I think it is also very important that Prof have touched on the point of fake masks. I think this is until today, 2 years past. 2 years since COVID has been there, and the fake mask situation is still there. I mean, most people do not know that if you're looking at 3-ply surgical masks, you're supposed to look at ASTM level 3 and type 2R mask. But there are many fake masks out there. And that is another question of how much protection are the public getting, because they are not being informed, they're not aware if what they're buying is genuine or not. So moving on, Prof, some of reports have said that these self-test kits are unreliable. And what do you think is the accuracy level of the saliva test compared to the nasal type of test kit? What is your opinion on this?
Yeah, I mean, if we look at the whole report around the world, we can see that the unreliability of the test kit could be because of the issues that I have raised just now. It's not so much about whether I'm using a swab from the nasal or I'm using saliva. Basically, it's supposed to get above 95%. That's a key point, and a lot of studies around the world have shown that either by nasal or either by saliva, it is almost the same sensitivity that can be found. But again, the way how we deal with it, and the very first thing is, if the test kit is a fake one, no matter how right you are doing it, it could not get the right result for that particular matters. So don't worry about whether I'm taking saliva or I'm taking with the nasal. The difference might not be that much, but both of them will have to be sensitivity above 95%. That's one of the criteria for the self test kit to be registered in Malaysia, at least. So if it is below than that, then I'm not so sure whether it has been approved or it's a fake test kit in a way. So, ladies and gentlemen, your health is not about money. If you are sick, no matter how many millions you have, it will not help you at all. So at the very beginning, get a proper registered RTK test kit from pharmacy and also all the private hospital and other places, and ensure, try to match with the MDA, whether it being approved as one of those. So based on that, read all the information accordingly. This is why I say go to the pharmacy, because the pharmacist will help you to identify which, how, and what to do with the test properly, rather than when you go back, you're smoking, and then you gargle, and then you do the test, which is not quite right in that way. So get a proper advice. You will get a good thing. On top of that, proper test kit has to be purchased at a proper place.
Right.
Okay.
Yes. Those are pertinent information, Prof. Now, let's say we receive a My Sejahtera notification that we are a close contact to a positive case. So in this
Okay.
situation, what do you think is the best test for us to use?
Okay, so if identified as casual contact or close contact, they will receive a notification definitely. Okay, and the best thing is that to self-isolate if they are experiencing symptoms. And recently, our KKM, a Ministry of Health, has updated the protocol for managing the contact of positive cases. Okay, and whether what kind of test has to be done. The test is that if you started to have experiencing all these symptoms, like cold, fever, cough, and others, perform the self-test kit immediately, and if it is getting worse by, having difficulty in breathing and high fever, you try to get the nearby healthcare facilities for that. So whatever your status is, whether you are a close contact or whether you are casual contact, or you are not in that category, but you have developed COVID-19 like symptoms, test kit is the first thing. Self-test is the first thing that to be done. And then probably if you are still having negative, but your symptom is still there and it's getting worsening, probably RT-PCR will do the job to test whether you have been infected or not. And again, we have to remember is the duration when you do the test. If you are doing the test before 3 days for the self-test, probably you are negative, even though you might have some of the symptom with the self-test kit, but PCR will detect on the second day itself to see all these things. So just report to my suggestor that you have been tested positive and start your home quarantine for according to the protocol or SOP that we have currently. And this is a little bit concerned with people who do not have vaccination at all, who avoiding vaccination, then the complication could be much higher. And most of the bring-in death cases are these people who are taking it longer to stay at home rather than go to the hospital. And then when they arrive at the hospital, the situation is already pretty bad that, nothing much can be done. And death is the consequences of all these things. So again, do it properly, test it, getting worse, call the hospital and get it done. And hopefully you will be fine with that, inshallah.
Yes, thank you, Prof. I think that's quite clear explanation from your side. Now, Prof, moving back to Omicron, do you know that Omicron was the 15th letter of the Greek alphabet, which means the 15th star in the constellation, and they call it Omicron Piscium? Why do you think they've actually referred to this variant in such a way?
Okay. Initially, WHO names most of the organism around the world, the pandemic condition based on this Greek alphabet, So when we have alpha for COVID, we have alpha, we have delta, and then suddenly we have Omicron. It's avoiding the new and it's avoiding the Z. So it's actually Omicron is the pronunciation is not really Omicron, actually Omicron, and some may put it in a different way, but what it means is that in the Greek part is that it's a small O. It's not like Omicron. It's just a small O that they avoiding new and they avoiding Z in the alphabet. The reason is that they don't want, the WHO don't want to have an impact on the certain countries or certain persons. Say, for example, Z is a last name of a lot of people in China. So if they try to put coronavirus Z and everybody with the Z name doesn't look good, you are the carrier of this and so on. And it will not also go with the country. Initially, we have things like UK variant, South African variant, so they name it accordingly. So at the end of the day, WHO agreed that they have this Omicron to be named. So there goes, we are living with them right now in our country and also the whole world.
Thanks, Prof. I think the Queen's English, they're claiming that, you know, it's a pronunciation is Omicron, but most of us are saying it as Omicron. So
yes,
it's chicken and egg story, perhaps.
true.
Right. Now, Prof, coming back to the topic, with nearly 80% of the population in Malaysia having completed 2 doses of vaccine and nearly 50% for booster dose, how effective do you think are the currently available vaccines against this variant? And is there a need to develop new vaccines specifically for Omicron?
Okay, so this is a thing we have to look at the general thing with the infectious disease. You know, we still remember H1N1. You know, we still remember a number of other conditions that spread around the world. It doesn't mean that it might not be effective. But a number of studies have shown that for those people who only take 2 short courses of mRNA vaccine, for example, you know, they might have a less effective against this variant Omicron, especially the people with the comorbidity, you know, the cardiac and diabetes and so on. And the current figure shows that it might offer about 30 to 40% protection for the infection and 70% protection against the hospitalization without the booster dose. You know, but with the booster dose, it increased the effectiveness of infection around 75% and almost 99% against the severe condition. So this is something that people have to realize, that the booster dose has to be there to help them to overcome the severity of this condition. We know that this Omicron is very fast spreading, but it doesn't go to the level of causing a lot of complication. But again, we have to remember, a lot of these people who are not having this complication are already vaccinated. You know, and most of the death in ICU or bringing death in our data, it shows about more than 50% of them are not vaccinated. So these are the things that we have to remember. And whether do we need to have a new vaccine? I just give you example. Early this week, you know, we have another new things from Hong Kong. You know, I think the moment we are doing a vaccine for Omicron, another one is emerging from another part of the world, and I don't think that we need to have all those kind of things, and the people will be very confusing. Now I have to take another dose, you know. So the best thing is that protect yourself with all the SOP that has been used. If you have not been boosted yet, take it, because it helps you to prevent this kind of condition, you know. So they are doing a lot of researchers right now are trying to focus on at the new variant that we have, but it will take some time before it can be used. And I'm just scared that by the time we are going to use for Omicron, there's another new things coming up that might not be as effective as what it is. So the best thing is that control yourself, take care of yourself with the whole lot of things, be healthy, and get a proper advice from the proper people, because sometimes people will just simply say, you take this and you take that, and at the end of the day, you end up in ICU. So this is a thing that we will say that probably, to me, I can see that the current vaccine that we have right now, though it might not be 100% effective against Omicron, but again, the third dose of the vaccination that being given to the public help them to prevent for the severe diseases or the complication that might occur with this kind of infectious.
Yes. Okay. Yeah, I agree with you that I think in France they now have discovered new variant, right? Recently, Deltacron, recombinant between Omicron and Delta. So the list
Yeah.
is going on. Yeah. Now, Prof, the first laboratory study on Omicron's ability to evade immunity, I think just recently, they reported that the fast-spreading Omicron SARS-CoV-2 virus variant is highly likely to compromise some of the protection from vaccines. So, in a response to that, in your opinion, do you think the Omicron variant decreases the effectiveness of the current vaccines we have? I mean, with regards to this published study.
Well, that was the reason I said, probably the vaccine might not working that well in certain people who are having certain condition. It's already published in some of the data that we have early this year, but majority of them will be responding very well. The only thing is that if you came in the hospital at a late stage, then you might have all the other complication with you. Probably you might have the COVID-19 infection, but again, on top of that, your renal is not doing well, your diabetic is out of control, hypertension, cardiac, and that might be a contribution factors that leading to death. But if we are talking about the effectiveness of the vaccine per se, there has been, as I've mentioned, the data have shown that if you are having 2 doses and then 1 booster, the effectiveness for the severity of the disease is about 99% effective. So again, this is where we have to remember, but people might be confused. I've been vaccinated and I've also had my booster, but I still got it. But we have to remember, vaccine is something, it's not going to be forever in your body. You have a different mechanism in the body that you can just retain it for a certain time, 4 to 6 months, and then your body need to adapt to the situation. So this is where exposure, like what we are dealing right now in the first April endemic condition, where people assume COVID is our friend right now, so your body will get to adapt to the situation, But again, for those who are not having any vaccination before, might rethink about it, because the complication could be very high in that sense.
Yes, yeah, thank you, Prof. Now, moving on from human concern to pets now. Some of us have pets, and the common worry is that if the pets are, is it possible for the pets to be infected with Omicron? And if so, can they transmit to humans? What is your opinion?
All right. We have heard about how does this COVID come from, from a market that sell a lot of animals and kind of things, and there's a number of research that has been done toward looking at the kind of transmission between human to animal, animal to humans, and they discovered that some of the variant might be circulating among the human is also already there in the animal, okay? But Omicron is transmitted among human much easier than the other variant as compared to the rest that we have. And it is likely to transmit easier among the pet. And we can see that around the world, if you go and read some of the zoology news, around the world, many mammals species in the zoo already have been infected by the COVID-19 because their caretakers are positive with COVID and so on. While these animals are being now vaccinated, but it is not as much as they can contribute it back to human. There's less data to show that the animal got it and then the human will get it. Okay, so what we need to know now is that the risk of spreading SARS-CoV-2 virus that causing COVID to people is low at this point, and the virus can be spread from people to animal during the close contact. Because sometimes you love to cuddle your dogs, your cats, and they will definitely got it if you are positive. And I would assume that there's more studies to be done to understand if there is a different animal will be affected by COVID. Mink, for example, in Poland, we know that some of the a big, people who are having mink that have to be slaughtered because of the COVID, so we need more about that. But the risk of animals spreading COVID to human based on the current available information is pretty low. And the risk of people spreading to animal, it can be done. But again, the animal will be having kind of, like a flu-like conditions, slight fever, and so on. But as long as we know what to do with it, if you are positive, try to avoid, hugging your pets and so on, because they might be contributing to that, and they might get worsened. But from them to you, the data show that it's a low risk, not so much as we contributed to them.
Right. Okay. Thanks, Prof. I think that enlightens some for those of us who have pets. And not only we need to protect ourselves and our pets, but also transmission of these to others as well. Thank you, Prof. Now,
Most welcome.
Thank you, Prof. Now, moving to Prof. Zamberi. Prof, as a co-head of COVID-19 and Infectious Disease Task Force, in the Academy of Professors Malaysia, how do clinicians detect and diagnose Omicron infection?
Thank you, Dr. Morgana. Assalamualaikum warahmatullahi. Very good afternoon, everyone. Okay, this is talking about diagnosing and detecting Omicron infection clinically. Basically, at the moment, when you diagnose somebody or suspect COVID-19 patients, you can only guess that it is Omicron based on the trend that now you can say vast majority are due to Omicron. But we cannot deny the fact that some of the COVID variant may be something else. Maybe the Delta is still looking around. But in fact, now Omicron is so infectious that we can safely say that you got Omicron at the moment. You can be 99% correct if you guess to Omicron. But nevertheless, for clinically, that is not that important. I don't say it's not important. The priority is to see whether the patient is progressing to become worse, or or having just mild or asymptomatic. So for the clinical point of view, regardless whether it's Omicron or Delta or even Alpha, the ancestor of COVID-19, it doesn't matter. We're looking at whether these really progress to the seriousness of the disease. But for public health purposes, of course, it's really important to detect and to keep trend on the change in the variant. We may get another new variant, and see whether that can actually. What we're worrying is that getting more infectious and maybe more virulent and maybe undetectable by our test kits. So that is my short answer.
Thank you, Prof. Now, some people have this confusion. Can Omicron be detected via the self-test kits? Meaning, does the Omicron variant respond in the similar manner as all the previous variant when we are using the self-test kits?
Yeah, that is the concern initially when we heard about Omicron coming in, even Delta coming in, whether our test kits, our current test kits are able to detect it. But from the Ministry of Health view is whether it can detect well or not. You can sometimes, the detection rate may be less than desirable compared to the ancestor of the COVID-19. At the moment, we can say that they have Ministry of Health have done the test, and it's concluded that Omicron can be detected by home test. But nevertheless, our manufacturers probably have to tweak a bit on their antigens use or the primers use, to detect the current variant, since we know that Omicron now is the most dominant variant throughout the world, actually.
Right.
And just to add, the subvariant of Omicron, B2, is lurking, and also that may be we have to check on. So because we know that some countries like Hong Kong, that is on the rise. Over here, I've not heard of reports on that at the moment.
Right. Okay. Okay, Prof. Now, reports have stated that Omicron is less severe variant compared to Delta, but more transmissible. What about the health complications caused by this variant, Omicron variant? Are they similar or different?
We can say it's almost similar. The trend in Malaysia is that it causes mild disease, as evidence from the daily announcement by the DG. You can see that the serious cases are much lower than what we experienced previously. Well, WHO has been very cautious because what's happening in Malaysia is because we have population immunity, a very good population immunity, I can say. Vast majority has been vaccinated, having 2 doses, and 50% has gotten their booster doses. That actually has implication on keeping the disease as mild as possible, and most of us actually are asymptomatic. I have many friends who got infected, and most of them say just sore throat and a bit of fever here and there. I'm sure you all also this experience. Basically, all around us, our colleagues have been infected with Omicron. Well, that's the good thing. But if you look at data from Hong Kong, Hong Kong is another interesting. Currently, Hong Kong is facing a really bad situation whereby a lot of death. The death rates actually is worst in the world at this moment of time, and most of the deaths are among the elderly, and this is due to Omicron. And why elderly? Because they have this zero COVID policy, and therefore vaccine strategy was not put. And for us, we are quite aggressive about vaccine policy, getting all of us to be vaccinated. But for them, it's more of promotion, getting encouragement for them to get the vaccine. But the elderly, it seems that the coverage on the vaccine is not that great, less than 50%, and that's why you see a lot of deaths among the unvaccinated. So you're talking about COVID-19 Omicron variant among the unvaccinated, and it causes death. So it is not as mild as we think it is. So we have to still be careful about this. And in fact, in Malaysia, the deaths are among those who are unvaccinated. Still, some of us are unvaccinated, and those, of course, with comorbids and in the elderly, among the elderly.
Right, Prof. Aligned to that, many reports have been viral on the long-term side effects of COVID-19, causing panic amongst especially those who have recovered from COVID-19. So at this current stage of research, what is known about the long-term side effects after being infected with COVID-19?
The short answer is we don't know as much as we like to know. Well, this COVID-19 is still a mystery for us. A lot of people has got this, what we call long COVID, long haul for COVID, sometimes they call it, meaning that someone has been infected, and then after 3 months, they still got some symptoms, but they are not infectious. So that's the good thing. It's just that there's some remnants of these symptoms in the body. They can have like a chronic cough. They can have like we call that brain fog, confusion, and cannot focus, cannot concentrate, so things like that. And even some of them has this inflammatory, multi-system inflammatory, what do you call it? This it's an autoimmune disease coming as a result from this Omicron. So a lot of things, and COVID, it seems it's not just restricted to respiratory organs. It is a multi-organ, and even attack your immune system. and causes autoimmune. So a lot of things are still under research now. Even we, the scientists, has not agreed on the terminology. What is the definition of long COVID? So that has not been sorted out yet, because they are still looking at the mechanism, pathogenesis of all this. So still after 2 years, still unknown.
Hope we get some insight on that soon. All right, moving on, Prof. We have some scenarios for you. Some scenarios that have been creating some confusion amongst public. First one, according to the latest guideline by KKM, COVID positive patients who have received their booster shots are required to quarantine for only 7 days. Whereas the asymptomatic close contact patient or those who do not exhibit any symptoms do not require any quarantine. Does it mean that after receiving booster shot, the risk of spreading the virus is much lower? Or is it that this guideline is set only for the convenience of the community? Could we have your opinion on this?
Okay, now, a person has been positive, a patient has been quarantined because he or she is positive, and the close contact, which is now asymptomatic. So why only 7 days? Do not need any quarantine. Right? Okay.
Yes.
Now this we have come to a stage that not like last time we have the PKP and MCO and all that. We just make people don't move around, just lock them in the house and things like that. But now we have to encourage the opening up of the economy and all that, because this is actually the balance of it. Of course, ideally, he or she should be quarantined as well. But looking at risk assessment, those who have taken the booster doses, the risk of getting infected is much, much less. And more so, we have this test kits, self-test kits. So that helps in terms of knowing that whether you are infected or not because of your contact with that patient. So the most important thing I think here is trying not to restrict people's movement, because you see what's happening, the huge impact on everything, psychological, economy, and things like that. So this is like a trade-off, and we know that because you are getting boosters, the risk of getting is much less. Of course, I don't want to brag, but there's so many people around me getting infected. So alhamdulillah, at this point in time, I've not been having all this, and that shows that the vaccine is working, because taking wearing masks and taking precautions and distancing and things like that. So in short, it doesn't mean that it's for convenience of the community. It, of course, is trying to be convenient for the community, but there's a risk assessment there and also evidence-based.
Okay, right. Thanks, Prof. Now, scenario 2, COVID positive patient who received a booster shot is required to quarantine for only 7 days based on KKM's latest guideline. If the patient is still tested positive with PCR or via self-test kit at the end of 7 days, do they still need to quarantine themselves?
Okay, the issue here is whether after 7 days, he or she is still infectious or not.
Yes.
Right? So that's the key issue. So now looking at this, but before that, before we have all this booster and vaccine thing, after 10 days, we're looking at a period of 10 days. After 10 days, if you go through a normal infection and all that, beyond 10 days, even though your PCR is positive, you are not infectious, because that is the awareness. And there are studies showing this. They've taken samples from patients at day 11 and so on. Even it can be positive after 1 month. And they did some viral culture and all that, and could not find any live viruses, so-called live viruses. So that's evidence saying that even though it is positive, you are not at risk of spreading the virus anymore. So why the need to quarantine, right? So that is the usual thing, the 10 days. So in this case, booster shots to be continued only 7 days, but in the US, it's 5 days. So we are taking a middle line here. But for in the US, to be fair, it's 5 days and another 5 days for you to be cautious wearing mask. So to just to be sure that we're not spreading the virus. But for us, it's 7 days and beyond 7 days, it's no longer infectious. So that's the main reason.
Right. Okay. So the reason is because they're not infectious upon the quarantine days. Okay. Right. Thanks, Prof. Now, final scenario for you. If a patient was tested positive and after a few days of recovery, he or she has a close contact, does he or she still need to go to undergo self-isolation? Your feedback, Prof.
He or she refers to
the patient.
The patient, okay.
Yes.
So this patient is tested positive and then she has another close contact.
Yes, after recovery.
She's a close contact of someone.
Yes.
Okay. So does he or she still has to go under self-isolation? Well, if you're positive, you still need to go for self-isolation, isn't it? It's just that if you have, for example, you have another close contact, then maybe do you need that extra days to be quarantined? So I don't think so, because when you're infected, you are producing antibodies against these viruses. So it's kind of like acquiring natural immunity. So it doesn't make any difference in terms of quarantine days.
Okay, right. Thank you very much, Prof. Zamberi. Now, I would like to say thank you to all panel members for sharing with us many pertinent information regarding Omicron, what we know so far. Moving on to question and answers, I'd like to open the floor to our panel members, any one of our panel members to answer these questions. We do have one question. If a person who has taken initial doses had anaphylactic reaction, can they take booster? This is from our participants. Any panel members would like to answer this?
Well, anaphylactic reaction is a serious adverse event. And we need to know what vaccine. Normally, generally speaking, the mRNA ones that people had quite a lot of side effects being reported, and some reports of anaphylactic reaction as well. And the lesser ones like the inactivated vaccines, because it's given routinely before in children and all that, and probably they have already got experience and it's not shown to have anaphylactic. So maybe the question here whether they can take booster or not. So they have to be assessed first. Booster is important because currently now we see that those who are boosted, they can have quite a severe disease because practically, even though they have taken the vaccine, their immunity has really gone to zero. And where people say it's almost the same as you have not taken the vaccine, well, there's some truth in it, but maybe there's some element of the T cell immunity as well. So probably my take is it's not as serious as those who are unvaccinated. So here, booster is important. What kind of vaccine? So that the doctors need to assess.
All right. Okay. Hope that answers the question from the floor. We have another question to our panel members. Question is, within 3 months after contracting COVID, tests will likely still show positivity due to virus fragment. Is this directly implying that no test is required within 3 months? How to differentiate between reinfection, i.e. may not be having symptoms, or an individual with residual infection? This is our next question from the floor. Any panel members like to answer this? Maybe Prof. Zamberi or Prof. Azhar?
I think it is the same issue that we have mentioned just now. I mean, Prof. Zamberi have mentioned about the situation where somebody is done with it after 1 month, then tested positive again, it could be the fragment of the virus. But again, if you are being exposed to another condition, you have all the symptoms all over again, then it's better to do all the tested, all the things, so that we have to make sure that you are not having a more severe condition and so on. It could be that you are having another infection like pneumonia on top of COVID that you might have. So that could be a slightly different issues that need to be looked up. So again, to me, you need to really evaluate the situation. The doctor will have to see the patients and discuss about it and see what's next to be managed for that particular patient.
Okay.
Yeah, reinfection is, those days we say it's rare, but now it seems that it's not uncommon. I mean, slightly less than what I said. It's not rare, but it's above, slightly above it. You get my point here. Getting reinfection is what do you call that? Nothing. It's something that we expect because of the change in variants and things like that. But to say how to detect whether it's a reinfection, then you have to show that. How do you know that you're going to be infected? You must show that you have been infected before.
Yeah.
And why do you want to test now, right? If you have symptoms, then you test, right? So if you are asymptomatic and the test is positive, then we have to check whether it's really due to false positive or things like that.
Right.
So it's not easy answer to answer, easy question to answer.
Okay. All right. I hope whoever asked the question have some clarification from there. Another question from Yap Chui Ling. If a person is reinfected with COVID, how long does the immunity against the virus last?
Okay. Regardless whether vaccinated or natural immunity, it was found that the antibody will drop, just like vaccination after 6 months, it just dropped to sometimes 0. So that is kind of worrying. But then we have for immunology, you have the B cell and then the T cell. The T cell, it seems that plays an important role for severe diseases, and why we do not detect this, because it's quite a tedious test to do. It's not easy and it's very expensive. But we can say that once you have been infected and recovered, when another variant comes in, most likely you'll get a mild one, because even though your antibodies are 0, because the T cells are there doing the job while getting your antibodies to be boosted naturally.
Yes. The memory of our immune system, yeah?
Yes.
All right. Okay. Next question from Miss Fatin. What is the management if both parents are positive, but the child is negative? I guess she's asking, how do they manage themselves in a family unit? Anyone? Dr. Rahila, would you like to answer this? I'm sure you've seen many of such cases.
Okay, so parents are negative, is it? As parents positive?
Both parents are positive, but the child is negative.
Okay, so basically we go to the standard SOP, okay? First, you have to monitor like what kind of symptom as well. Even though it's negative, we are not sure. As we mentioned earlier that, a lot of, you can say like, a lot of results, variable results, sometimes it can be positive, sometimes it can be negative. So for me, you monitor the symptom. At the same time, maintain the SOP, okay? Try to lessen the exposure to the kids themselves, okay? And then, of course, for example, we have to follow like proper SOP, for example, hand sanitizer, has to use the hand sanitizer. At the same time, maybe wearing masks, okay, for you to actually lesser the exposure to the kid. At the same time, ventilation, yeah, open the windows, all that. So I think by following the proper SOP, perhaps we can actually minimize the exposure to the kid themselves. But at the same time, don't forget to monitor the kid's symptoms. That is very, very important. We cannot just follow proper SOP and then we don't monitor. Baby is like tested negative, but actually the kid is actually positive. So
Right.
we have to bear in mind, yeah.
All right. Thank you, Dr. Rahila. Okay, another question. For a person who has completed 2 doses of vaccine, but not the booster, when they get infected with Omicron variant, how soon after this infection should they take the booster shot? Over to the panel.
This, it seems that even though they have been vaccinated and then infected with the COVID-19, they still need to take a booster dose because studies have shown that the severity of COVID, whether you are asymptomatic or mild or even severe, does not correlate to protection of the antibodies. So the question is how long? So there is a standard duration after your second dose on how to dose. I think it's 6 months, if I'm not mistaken.
Yeah, 6 months.
So answer is you still need to take the booster shots.
All right, okay. Question from Mr. Por. There's a statement saying that eventually COVID-19 virus is going to mutate continuously and become a variant which causes milder symptoms, similar like flu, as the virus wants to coexist with humans. What are the panel's opinion on this statement? Thank you.
Yeah, I think this is a same issue with all the other infectious disease around the world. You know, before COVID, we have a number of things that like Japanese encephalitis. Before we have outbreak of meningitis in our countries once upon a time, and all those things. Those are the infectious part of it. It will definitely mutated, especially with this COVID-19. You know, it will come to the point where the immunity, herd immunity in the community is achieved, and then by then probably it's going to be slightly different things. You know, you can see right now we are almost entering the endemic condition. You know, the situation today is totally different when we have it in 2019. You know, where everybody so panic about all the situation. You know, some are concerned about all the other issue and whatnot. So whether we like it or we don't like it, this virus will definitely mutate. You know, we can just see alpha, delta, and we have about more than what we anticipate at this point. And you can expect after this, I don't know what their name is going to be. It's going to be, we're going to be living with them, whether we like it or not. But follow all the recommendation by the Ministry of Health accordingly, and definitely will be at least protected in a way.
Right, very true, Prof. We have to coexist. So
Yeah.
We're having a lot of questions now. Let's see how many questions we can take. Now from Miss Mandy, Sinovac is approved by Ministry of Health for children of 3 and above, but I understand that full dose is given, unlike Pfizer, where a small dose is applied. Do we have any studies regarding this full dose of Sinovac on children? Panel members, anyone would like to take this question? Dr. Samberi or Dr. Rahila?
Something that I'm aware of at the moment.
Well, no idea.
All right. So Sinovac is given at the full dose for children at the moment, or it's lower dose for children currently in your practice, Dr. Rahila?
So the best person to answer this is of course somebody from the NPRA. Okay.
MPRA.
I understand that of course pediatric usually we will give like a half dose compared to adult, no matter in whatever medication. Okay. So I think maybe got some evidence. First we know that Sinovac is not recommended at earlier part, but now I think maybe it become like one of the vaccine that actually proven to be like safe in the pediatric, and perhaps the dose definitely won't be like the same dose as adult, but I'm not very much sure about this. Yeah, so perhaps we can get like somebody that really in this area to actually advise properly.
All right, so we'll come back to that question shortly. We'll come back while we attend to the other questions here. Now, Ms. Yap William, she's a concern of COVID, of the virus being airborne. For a COVID positive person that is staying in a condo, is it recommended to open the window for ventilation? If I do, will it affect the residents staying above or below the unit who are also keeping their windows open? Any comments?
Yeah, I think one of the things that we need to be concerned is that the air circulation. If you close the windows, you close the door, and you on the aircon, the lasting of COVID is going to be slightly higher as compared. You open up, the sunlight will come in and reduce the risk of more infectious condition in their house. But if you're living in condo, I don't think there has been any reported studies to show that living in the condo, the risks are much higher as compared when you are in, say, a double story house, or a bungalow or whatever. As long as everything, for the air circulation is fine, then it's going to be okay. Because I take it from my own experience. My daughter's place, surrounding her place is everybody is positive, but everybody is taking all the effort to have a good circulation. Alhamdulillah, she didn't get it, the whole family, but those are the things that we have to remember, because air circulation is very important. It lasts, usually the COVID will last about up to 72 hours, depending on the surface. They'll be more on the plastic compared to on the papers, and also wet condition and so on. So this is how we deal with it, So I don't think a big problem if you open up your window and your neighbor's going to get it, because it's already, it cannot just last. It doesn't mean that when the COVID is out of your window and see, oh, the other window is open, I'm going to go into that house. No, it's not that way. Those people who are in the aircon are more risky to have this. And we have seen this numerous hospital places, especially in the offices, where a lot of people that work in the same office, if one person is having it, you can expect that a number of them will be contracted with this kind of condition.
Right.
Yeah, just to add, Dr. Morgana.
Yes.
This when you talk about all this, is more related to like the viral load, how much you are exposed to the number of the viruses. So in closed environment, you are of course exposed to lots of viruses, because it's continuously circulating and you breathe in the viruses. Whereas in environment like open air, the chances of you breathing in, of course, there are some viruses you may breathe in, but not as much as in closed environment. And this small amount of viruses or COVID viruses, our immune system are able to just get rid of it.
Right, correct. All right. From Ms. Ponmani, how to deal with post-COVID effect? Is there any treatment or prevention from having this long post-COVID effect? She's referring to long COVID, I think. I think she's asking about any precautionary measures that a patient who has recovered need to take in to prevent any long-term COVID effects?
Yeah, okay. Long COVID, of course, there are some risks. Generally speaking, it happens to those who are having moderate to severe disease, and India from 30 years old above, and also having some comorbid. So these are groups of people, but of course it cannot be applied to all. And prevention and treatment especially of this long COVID is mainly symptomatic at the moment. Prevention, we really do not know how to prevent.
Okay, all right. Next question from Miss Audrey Ko. What is your opinion of getting infected after receiving the booster dose to gain super immunity? Regarding super immunity, anyone would like to take this question?
Super immunity, I'm not sure what immunity means, but of course,
we've heard of herd immunity, but this is like super immunity. So
if I can just try to understand what the question is, maybe after getting booster doses and being infected, that actually strengthen your immune system. You get more antibodies, you strengthen your T cells. It's just like our soldiers going fighting all the time, and they get really good at fighting some other enemies. So maybe there are no studies to show this, but in theory that's what's happening. In fact, getting all this exposure to all these viruses, it actually train your immune cells to be alert on so many other future infections.
Yeah, I agree, Prof. Zambri. I've read a few articles regarding the memory B cells, that for those people who are having serious illness. So they are doing all these things to see whether the human being of the memory B cell of the human can really change us to the super immunity, as mentioned by one of this question, but that is still at the stage of they're looking into that, but not really a confirmed situation as it is right now.
Right, correct. Okay, now one very general question now from Mr. Lim. As the COVID situation recovers and shifts into endemic phase, what can the healthcare system do to better prepare our community to handle future outbreaks of infectious diseases? I think this can be answered by any panel members.
I think this is an issue of a public health that need to be taken care by all of those healthcare providers. Pharmacies is one of those, and you have to equip yourself with a new knowledge. We don't know anything about COVID before this, but by now we know quite a number of issues that related to COVID. So what we can do to prepare is that to look at all the other condition that might be alarming back to our country. For instance, I was in Sudan before COVID that coming up, and a number of leprosy cases increased very drastically in Africa at that point. That could be one of the things. And a lot of people in the healthcare system has been trained to look at all these issues, and then suddenly COVID was there. So I'm not so sure what happened to the things with the leprosy that coming up, whether it's still there or a different kind of thing. So this is a kind of a situation where we have to get prepared for it, get the knowledge accordingly. All the healthcare providers might be, sit down, as Prof. Zambri is one of those committee for the infectious disease. It will be good that these people will need to know what to do, how to do things accordingly at their level. Say for pharmacies in the community pharmacy, they need to give that kind of information to the patient that came into their pharmacy, and so on and so forth. So by having a good knowledge with a good platform in the country under the Ministry of Health or so on, even MPS, Malaysian Pharmaceutical Society themselves, can become one of the official promoting some of the information regarding a proper taking care of if other kind of infectious condition is going to be likely in our country.
Can I add something?
Yes.
Please, Dr. Aila.
Okay, actually, looking at this, if you see the mortality with regards to COVID, regardless of what type of variant, so we can see that actually comorbidities is one of the factors predispose patient to, to get higher mortality risk, for example. So to answer this question, first thing we have to know everybody need to be vaccinated. That's one thing. Second thing, we have to tackle non-communicable disease, because patients with comorbid actually end up with, like severe infection as compared to patients with like no comorbidities, including the elderly. So now looking at our, our system now, when we're focusing on the COVID, so sometimes, at some point we are neglecting about the non-communicable disease. People very scared to go to the hospital because of COVID. They didn't get a proper treatment. For example, hypertension doesn't get the good, BP control, doesn't get good sugar control. So all this actually can, predispose you to get like severe infection. So for me, even for the pharmacists out there at the retail, if you see patient coming, with the non-communicable disease, they have all these comorbidities, we need to advise them to get proper treatment. They will end up with severe disease of the infection if, let's say, they have comorbid compared to patients without comorbid.
Right, thank you, panel members. Now, a lot of questions from Ms. Fu. How to explain where if a person who takes first dose of Sinovac and has extreme fatigue from day 2 for more than 8 months, meaning I think what she is trying to say is they've taken the Sinovac first dose from day 2 post-vaccination until 8 months, they have been experiencing extreme fatigue. Any panel members?
Tough question to answer.
It could probably be the individual reactions.
Yeah. Well, first we need to decide, or determine whether this fatigue, extreme fatigue, is due to the vaccine or is coincidentally due to something else. Can be a EBV or Epstein-Barr virus infections ongoing, and then coincidentally at that time he or she has taken the Sinovac vaccine, and then they get this all chronic fatigue. So that needs to dig up a lot of history and a lot of investigation and physical examination as well to see whether it's really due to Sinovac or something else.
Right. Thanks, Prof. Any other panel members like to take this question? Yeah.
Probably the other thing is that, as mentioned by Prof. Zamri just now, we don't know who is this patient. Is it an elderly patient? Is it a young patient? Or, a young adult? Kind of things. But again, as mentioned by Prof, that these fatigue condition could be a lot of contribution to it, could be ME, myalgic and encephalitis and so on and so forth. So if the patient is taking drugs, whatever medication for whatever condition, it could be also prolong that kind of situation. Again, the very first thing is that whether this fatigue condition is caused specifically by that particular vaccine is very, very important for us to determine before we conclude that the Sinovac, for example, in this case, causing such a prolonged fatigue for more than 8 months. I haven't come across any case studies so far that are looking at the that long fatigue, even after the first dose of the vaccination. So all those issues need to be looked up again. Probably is a contribution of multiple condition that lead to this prolonged condition of fatigue more than almost 8 months already.
Yeah, we cannot also rule out. Also, we must remember sometimes psychological reaction giving rise to all this fatigue. For example, my experience, whenever there's people saying that, oh, we are just now our colleague was tested positive, immediately you feel something in your throat and feel like unwell. It's more psychological. Or even before doing your self-test, you feel not well, and when it turned out to be negative, then you start, oh, okay, I'm all right, and you feel better. So this just on the lighter note.
Yeah, can I add something? Yeah, actually, I agree with the panel. Okay, first we have to know what actually causing the patient to have that, like reaction, for example, fatigue, all that. Another thing, in my experience here, actually, after the certain patient, when they're having like reaction on the vaccine, sometimes our immunologist will check whether do they have allergy towards the excipient inside the vaccine itself, like polyethylene glycol, all that. So that one also need to be like evaluated. So I think if the patient having the reaction, they need to report and get the proper follow-up to know, what actually causing that, because we don't want the patient to skip the second dose and the booster dose. It's really, really important. That's why I need to be follow up on that.
Right. Now, as in response to the earlier questions on Sinovac, where let me scroll up to the question. Yes, by Ms. Mendy, that Sinovac is approved for children aged 3 at full dose, unlike Pfizer that's given in a smaller dose. So I think in Malaysia, 1/3 children dose is 1/3 of adult dose for Pfizer, but Sinovac is at its full dose because the company has published data that the their Sinovac dose is safe. Previously 18 or above, and now 3 to 17 years old. I think that is the reason why Sinovac is given as it is to even children, because of their published data. Yeah. So hope that answers the question. We have one more question by Ms. Kaur. If a person is already quarantined for 7 days, but he still does PCR and the CT value showed that it's below 20 or tested positive using test kit on day 7, is it recommended to quarantine again for another 7 days?
Okay, for this person, we do not know whether they're vaccinated or boosted, but doing CT, the PCR and the CT value is below 20, it means that the viral load is still high. And of course, it's a bit unusual if this were to be a person having booster. But the condition, whether the person has or whether has comorbids or immunocompromised, also plays a role there on the prolongation of the viral load for patients. So generally speaking, you can say that if vaccinated as a boosted is less than 7 days. But for this, it's clearly clear that the viral load is very high. So they still need to be quarantined.
Right. Thank you. I think we've come to the end of our questions here. All right, and also towards the end of the webinar. Thank you again to all our esteemed panel members for your time today. I think every one of you have given extremely useful information to our participants today. And we hope, on behalf of our organizer of Malaysian Pharmacy Society and Academy of Professors, we truly hope on behalf of them and on behalf of the panel, we hope that this webinar has been very beneficial to everyone and has helped to enlighten a lot of the confusion and queries that we all might have on Omicron. So with this, we'd like to end this webinar today. Thank you very much, everyone. And thank you to Prof. Zamiri, Prof. Azhar, and Dr. Rashid. Thank you very much.
Prof, maybe we can take a group picture.
Yes, so could we request can we request all our participants to switch on your webcam so that we may have a picture for memory.
Okay, so we have about 8 pages. So I count 1, 2, 3.
So we have to continuously smile for the 8
Yes, yes. Okay. First page, 1, 2, 3. All right. Second page, 1, 2, 3. Third page, 4, 5, 6, 7, and 8. Thank you, everyone.
Thank you.
Thank
I would
you.
like to also thank Dr. Zhu on behalf of Academy Professor Malaysia for helping us to organize this. Thank you very much, everyone. Have a good day and do stay safe. Till we meet again for series number 2 organized on this platform. Bye.